Yes.
Governor, just before I ask my question, if I can amplify a point by Ms. Gregg. To be blunt, right now, we're past, by the way, the 2-week window, if you will, for the dual vaccination. The state of Rhode Island is essentially putting into motion a plan that could result in the firing of nurses, yet for the same condition, policemen won't be fired. Is that true?
No, so I think that, again, I think Dr. Scott, and we'll certainly get back to her before October 1st so she can explain what we're working on at the moment. We're going to take every measure possible to make sure that no one loses their job, but at the same point in time, we're not going to relent on the fact that healthcare workers keep people healthy, and to be healthy, and they got to be healthy themselves to keep people healthy. So there's a distinction between what a healthcare worker does and even what a police officer does. Both have important jobs, but we're focused on the health idea here, which is in our congregate care settings, in our hospitals, they were at most risk. Now we're doing great on the vaccines, but we don't know what's coming down the line. This uncertainty has been there since I took office in March, and it continues today.
But both sets are first responders, and I do have a question for you, but there's a question of fundamental fairness there, isn't there? I mean, police in this state are above, if you will, the type of conditions as first responders that emergency care workers are, EMS drivers, EMS, all of those folks. There is a dual standard here. Is that correct?
Yeah, there's a difference in what they do, so if that creates a dual standard, then that's correct. I mean, the hospital workers, healthcare workers do different work than our public safety in terms of the police.
They both respond to accidents. They both respond to primary. I don't want to belabor that point, but
yep.
You know, there is. Will police who are not unvaccinated, will police who are unvaccinated be able to retain their employment after October 1st?
Yes.
Okay. By the way, this is the type of issue that's coming up again.
Your next question.
Okay. That was about to.
Yes. Well, you're on
I'm getting
computer. You're making progress.
Directly
That's
with people who, for example, one RN, registered nurse, who just finished nursing school a couple years ago. She's got something called unresolved pericarditis, which is listed on the exemption form. Previously, her doctor had suggested that she not get the vaccination. Now that doctor is unwilling to sign off on the form and is requesting that she seek additional treatment or additional analysis, which of course will take weeks. Is the Department of Health pressuring individual doctors, as is being anecdotally reported, to deny these type of, quite frankly, straightforward medical exemptions?
That's not my understanding, so I would say no.